Welcome back to another episode of the Behind the Counter Show. Today we are in Lyndhurst, New Jersey with Dr. Jag Desai, and we are with Core Medical and Wellness. Dr. Desai has offices here in Lyndhurst, in Clifton, and in Aberdeen, New Jersey. And Dr. Desai specializes in pain, regenerative, and sports medicine. So thank you, Doctor, so much for joining us here today. And of course, we're with James from HP Pharmacy and Gaspar's Best, along with me. I'm Vince. James is one of our pharmacists. And today we're talking about something that I'm interested to learn more about, the nutrient IV therapy, which is something that I'm a little bit unfamiliar with until we started talking about it. So I'm looking forward to kind of learning more about what's going on. So Dr. Desai, what exactly is nutrient IV therapy?
So IV obviously stands for intravenous infusion, and nutrients are basically your elements of zinc, potassium, magnesium, vitamin C, your B complex vitamins, your B12s. So it's a way of optimizing your body with vitamins and minerals that help support various functions throughout the body. In particular, the immune system is an important system that needs optimization for it to perform at its best.
Sure. So what then would be the advantages to doing the IV therapy as opposed to just regular oral supplementation?
So the advantage and more importantly, how they can work together. Because there are times when your body has difficulty absorbing from your GI system, whether it be from inflammation or a stomach virus or a stomach bug of any form. Absorption is not as optimal as we would like it to be. And when that happens, you start to become deficient in your micronutrients. And it's a cascading effect because then your cellular function starts to slow down and eventually deteriorate, and it builds on top of each other and these symptoms start to develop. So the idea of IV nutritional supplementation is to bypass your GI system during those times when it's not working as optimal as possible, and replenish your tissue and cellular micronutrients to get it back working as optimal as possible.
Sure.
And when that happens, your GI system usually is able to get back to its optimal function, and then you can resume a supplementation program. So I like to think of it as you have your oral supplements and you take them on a regular basis, but every now and then when something comes off balance, you can then take an IV supplement to get yourself back into a regular balanced level of function.
Sure. I think that's a really interesting point too, even from coaching nutrition or, at the pharmacy, we see people who are taking proton pump inhibitors all the time, refilling or getting it over the counter. And a lot of people don't realize how, it makes sense if you think about it logically, right? Like if your stomach is, not functioning optimally, you're not absorbing things well, obviously that's going to impact the rest of your body and your health and, your immune system, but everything. And, the way people eat these days or take medication like that, I don't think people realize how much that actually plays a factor and how doing something extra like this can actually make an impact in that sense.
Yeah, absolutely. It's, you said it exactly correctly. What we eat, so much of it is processed, and that plays a role in your digestive system's ability to absorb antibiotics and other medications like the PPIs play a big role in the body's ability to absorb. Patients who have had bariatric surgery and some of the gastric bypass procedures and sleeves, they have absorption issues. So a lot of those patients develop micronutrient deficiencies. And so all of these things play a role in the need for periodic IV optimization.
Sure. And optimization too. So just to clarify on that, what's the difference between optimization and then just regular supplementation? Is that just a level above, or is that different? Because I see, on products, you see, this is the minimum daily value or percent daily value. What's the difference between that kind of stuff?
So exactly. So the minimum daily or recommended dose is there to provide you the minimum amount that's required for at least some degree of normal function. But that's a big difference from optimal function, right? So, for example, you'll always see a range on some of your nutrient labels, and it's because the body does not always maintain an exact number. It fluctuates. Depending upon what you're doing lifestyle-wise and the activities that you're doing, Are you exercising a little bit or a lot? Are you training for a major athletic event? Or are you fighting off an infection? Are you recovering from an injury? All these things will play a role in determining how much of a nutrient you need. And that will then determine how much you need to consume, whether it be orally through your digestive system, or if there's an issue, or if you need to boost it for a certain period of time, taking it intravenously.
Sure.
Yeah, so I mean, so many people definitely see it on social media, like a lot of celebrities showing up, the fact that they're getting their IV therapy of nutrient vitamins and things like that. And sometimes it's definitely, as Doctor mentioned, it's definitely anyone in our general population can utilize some of these vitamins, not just through orally, but obviously through IV. So generally, what is the process? If I feel one day, maybe I can get some help from getting an IV supplementation, what is the general process? Is there any requirement that's involved? Do we have to check labs and things like that? How does it generally work?
Yeah, no, good question. So I think step one obviously would be to consult like a healthcare provider, because they will run through your medical history and see what's going on, what the symptoms are, and why do you think you may benefit from having nutritional therapy. Based upon that information, then they can determine which nutrients you would need. Not everybody needs every nutrient, and also what dose you need. And based upon some of that initial information, perhaps there will be a need for doing some lab testing. See what your micronutrient levels come back at. See what enzymes are functioning normally in your body and what could be optimized. And based upon that, they can help create a sort of a cocktail as to what type of infusion you should get periodically. And again, I think it's important to note there are various protocols out there for infusions. I personally feel like there's a role for IV infusions that you do periodically, but not every day. That's what your oral supplements are for. But in combination, if you do it periodically, say every 4 to 6 months, it will help replenish what's been depleted, help optimize what you currently have, and help make your oral supplementation program a little bit more effective.
That's great and all. But a couple questions that some people ask is, how do I know if I really need one? Like, what are some possible symptoms that you may be experiencing? Not just general fatigue, or as you mentioned, a bunch of different medications. Like, who would you really recommend it to? Like, who would you say, if you have this type of symptoms, maybe definitely give us a call or inquire about IV nutrient therapy?
So I think the symptoms, for example, vary so much from person to person, because it all depends on what they're feeling and how they describe it outwardly. Yes, fatigue is one. Energy levels is obviously another term that's used frequently. Skin changes. Are they noticing changes in their elasticity? Are they noticing changes in their hair texture? Are they having more chapped skin? Are their nails not looking the way that they think they should normally look? These are some superficial signs that patients can sometimes use as a way to detect, okay, maybe something is off. Weight changes, temperature changes. Some of these things can all kind of help give you clues and insights as to what's happening. If you feel jittery, if you even feel your pulse every now and then, and you feel like something is off. Some of these things can play a role in determining not only IV therapy, but anything medically going on as well that needs to be investigated.
Sure. Or maybe just after the holidays, a little weight gain
Absolutely.
as well. Another question we get a lot at the pharmacy too, dealing with oral supplementation specifically, is, am I just paying for expensive pee? Which sometimes with water-soluble vitamins might be the case in some ways, right? But is there a difference in absorption? Like, obviously we talked about avoiding, possible challenges with the gut. How else, is there any other benefit intravenously for certain nutrients, for example, that may be better absorbed in that way?
Yeah, that's a good question. I get that a lot too. Am I just, taking it and I'm going to pee it out, and am I paying for expensive pee? And I always like to kind of say, well, no matter what, whether it's vitamins, nutrients, sugar, alcohol, whatever you consume, part of it's going to be peed out. So would you rather pee out, your body will take what it needs and for optimal performance, and it'll store some as much as possible as well. And then once that's done, yes, it will be excreted. But would you rather be peeing or urinating out vitamins or infection? Would you rather be peeing out nutrients and supplements or toxins? And I think that's one way to present it, because you're going to be peeing something out. What would you rather pee out?
Sure.
And your body will excrete what is excessive, what it doesn't need anymore after it's optimal. But it will, I guarantee you, it'll hold on to as much as the good stuff as possible. And that's what you want to do. You want to saturate your body with the good stuff and get rid of the toxins and infectious markers as much as possible.
Sure. So what about, speaking of the good stuff, it kind of just prompted me to think, what about in terms of quality? Like when, we do this with our supplements and that kind of stuff too, you want to make sure what you're putting in your body is, what you're putting in your body, and maybe there's not extra stuff in there, or actually what's on the label isn't there. So I'm assuming there's similar kind of quality control protocols for the IV therapy and where that stuff is sourced, especially if it's going directly into...
Exactly, yeah. You definitely want to go to a reputable place and use reputable products, because the dangers of, not using high quality products or not going to an experienced provider can be significant. You don't want to run into infections. One of the reasons you're taking it is to prevent infections.
Sure. Yeah.
So you don't want to develop an infection, or you don't want to develop what we call hemolysis or any of these other potential side effects. So you do want to use a safe protocol and go to reputable places and use safe.
So not your back alley nutrient dealer or anything.
Correct.
Yeah. Okay, makes sense.
And we say it all the time, definitely comes to a pharmacy sometimes when you try to get an oral supplementation of vitamins, not just some alley in the mall sometimes. There's so many out there. So many out there, yeah.
No, it's really true. So obviously with COVID-19 and everything going on, immune support as a whole has been a huge thing this year.
Sure.
Are there any indications or things you would recommend in terms of supplementation, IV specifically for, COVID-19 or just, immune support in general?
Yeah, I think, the general approach, the advice I give to my patients, and, that I personally took myself, is, you keep your immune system and overall body as optimal as possible, because that's, your number one defense is to, prevent something from even getting started in your body. So I personally, for example, I take my infusions periodically and I take my supplements on a daily, regular basis. But during 2020's peak season of the virus and the flu itself, I did optimize my body with additional IV infusions, vitamins and minerals to keep the immune system at peak performance. And I was fortunate enough to not have any symptoms throughout the year, even though I was covering in hospitals and healthcare facilities where COVID was present. So
sure, oh, that's great. What you mentioned the protocol there. What then would be the specific protocol that you would recommend for this or this plus oral supplementation, or what? Because obviously for most oral stuff you take daily, right? I'm assuming you wouldn't do the IV thing daily, or
correct.
Yeah.
So the protocol varies based upon exactly what your goals are. Most common is obviously the immune system and overall function of cellular metabolism. So those cocktails usually include your vitamin C's, your zinc, your magnesiums, your antioxidants like glutathione, and then your B complex vitamins and B12s you can get as well. And that's your basic infusion. Sometimes I have athletic patients or patients that are training for a specific sporting event or something, or have a soft tissue injury, whether it be a ligament, a meniscus, a tendon, who are recovering and rehabbing from those types of injuries. And then those patients of mine will infuse amino acids, branched chain amino acids, to supplement their regular protein protocol to help them in the recovery process.
Sure. I didn't realize you could do, I guess that makes sense, intravenously that too. Obviously, BCAAs are a huge workout exercise kind of supplement in general too. That's interesting. What about specifically, again, back to the immune stuff? Are there specific ones? Like we've seen, glutathione you mentioned earlier.
Yeah, we
vitamin
definitely...
D, like we've seen things on PubMed or in the news,
yeah,
right?
there were, when when COVID emerged, we got a lot of questions about glutathione, quercetin, melatonin as an immunomodulating effect. Obviously, vitamin D and zinc. We get so many questions that are probably on a daily basis. With supplementation through the IV, certainly can absolutely help you. Hopefully, to protect you from all these. You told us before, generally, it's obviously not everyday thing, but how often do you generally see people get the IV supplementation?
So again, that varies based upon what's going on in their life and what symptoms they have. I personally, for example, for myself, I'll use a protocol where every 4 to 6 months I'll give myself a booster of an infusion, just to optimize what I have in my body. And then during the course of the week, the month, I'll supplement with oral vitamins and other nutrients. And then if I feel like something is coming up, so if I feel like a flare in symptoms of either fatigue, weakness, if I feel like I'm having GI issues, then I'll give myself an additional booster.
Is there any other possible, some people do get a bit scared about, getting just injection period. Mm. Are there possible side effects that you may be experiencing from supplementation through IV?
Of course, yeah. So, obviously that's why it's important to go to a reputable place, because if you take too much of it or get it too quickly, there are certainly, symptoms that can develop that you want to try and avoid. So the emphasis on that definitely has to be to go to a reputable place and make sure you use good, high-level quality products.
Sure, that makes sense. And so you mentioned earlier, obviously, I think in medicine or most things, you want to try to get to the root cause of an issue and figure out, okay, what's, in this case, what exactly is low, what exactly is, what exactly are you deficient in that may be causing some of your symptoms, right? So if you're doing some of that testing, does that then mean that this would be covered by insurance in some instances, or?
So yes, yes and no. Insurance is always
fun.
The bane of all of our existence.
Fun times.
Yeah, exactly. So there are certain things and certain tests that are covered, certain treatments that are covered, and then there are certain that unfortunately the insurance companies deem not to be medically necessary, and as a result they do not cover. So it's hard to give one answer to fit all questions, but I think the way to approach it is speak to your healthcare provider, as well as your consult with your pharmacist, see which products they recommend based on the symptoms. With your healthcare provider or your physician, speak to them about your symptoms, and they can try and obviously come up with a diagnostic protocol that can help determine what the root cause is. And see if it can be covered by your insurance, and if not, look for the most cost-effective way to diagnose what's happening and then treat what's going on.
So that's actually what I was going to ask next. If someone, in this conversation, if it resonates is the word I was looking for. If it resonates with them, they want to learn more. What would the next steps be? How can they reach out to you? What would they,
I think obviously now in 2021. Everyone's first source for information is the internet.
Yeah.
And there are some good reputable sites that you can go to and get some at least basic information. I think from there, it's good to always speak to a licensed healthcare provider, someone who's spent time studying not just general medicine, but specific niche of medicine, which is nutrient supplementation, performance optimization. And get some feedback from them, see what kind of testing they can do, see what kind of treatments they recommend. And then also, from a day-to-day basis, speak to a reputable pharmacist and speak to them about what type of products they have, what they recommend. And then once you feel like you have enough information, you can then help tailor a treatment protocol that fits best for yourself, along with your physician and your pharmacist.
Sure, that makes sense. Thank you so much, Dr. Desai, for having us at your office here today.
Sure.
Are there any other last-minute thoughts on the IV therapy you have, or other questions or anything like that, James? Or?
Definitely, as Doctor mentioned, the quality is number one. Also, definitely talk to the most reputable sources, of your healthcare, not just from the internet. A lot of times we get that a lot.
Sure.
So that's what's the most
Google
important.
Doctor.
Yep.
Yeah, no, I mean, definitely, you can get some basic information from there, and then you can use that to help fine tune, your questions and your decision-making process when you speak to your physician and your pharmacist.
Sure, of course. And I think to add on to that, the way I see it is we're all unique. Like yes, of course, there are some protocols, and yes, there of course are some things that may impact a lot of people, but ultimately, talking to a qualified professional and getting some of that, even whether the testing you mentioned or other things, to specifically say, okay, this is what's going on with you. Even if you saw, broadly, maybe some of these things might be relevant on, the internet too, and that kind of stuff. Always having those conversations can help get a more positive outcome, I'd say.
Yeah, for sure.
Yeah, cool. Well, thank you so much, Dr. Desai, and we'll see you next time.
Sounds good.
Thank you.